Welcome to the Patel Perspective Podcast. I'm your host, Harsh Patel. I have obtained a bachelor's degree in neuroscience and minors in biology and biochemistry. Through that education, this podcast allows me to deliver proper health, science, and self-improvement information to the people around the world. If you have liked any of my podcast episodes, and if you would like to show support, the only way to do so is by subscribing to my YouTube channel and the social media platforms of the guests you have liked. You really don't want to miss on the highly intellectually stimulating conversations that we'll be having in future episodes. Today's guest is Dr. Nishi Amin. Dr. Nishi has obtained her bachelor's of dental surgery from India, and now she's trying to transfer her education and clinical experience into American dentistry. You can expect to learn a lot of things regarding keeping your oral hygiene up to date, because when we talk about health, we are talking about overall health, and oral hygiene should be one of the most prioritized things in your health stash. You can expect to learn why caffeine creates stains in your mouth. You can also expect to learn why Dr. Nishi doesn't drink cold drinks or sodas ever because of its poor health outcomes, and much more. We also talk about her business ideas in India, where it could potentially help small villages in India to take control of their oral health. And now, my conversation with Dr. Nishi Amin. Hi, Nishi. How are you?
Hi, I'm good. How are you?
I'm good. So I'm really excited to talk about oral health because personally, I really don't know anything more than just brushing 2 times a day. So I'm really
Okay.
excited to have a doctor of dentistry on and
Yeah.
just tell everyone where you're from and what kind of educational background you have had, and then we'll get started on the topics of today.
Okay. So my name is Nishi Amin, and I am from India, and I completed my bachelor's of dental surgery from Ahmedabad, which is a city in India. And now I'm in the United States. So here we are recording a podcast.
We're gonna make you famous.
Okay.
Yeah. Okay. So in India, if people don't know, in India, a bachelor's degree is comparable to a doctoral degree. That's right.
Yeah, it is.
Yeah.
Yeah.
So that's why I have I have offered Nishi to come on this podcast so that we could talk about oral health. And I have not seen a lot of health content directed towards oral health. And so I hope this spreads to a lot of people because oral
Yeah.
health is really essential. Once you hit once you get into problems, because when I was younger, when I went to the dentist, like when they checked my teeth, they would say that if you brush too low, your gums will start peeling off. And then that's how I ran into like gum bleeding and all that. I
Yeah.
recently started realizing that like bad breath is a turnoff for like communication wise, whoever
Yeah,
you're
it is.
talking to. And so all
Mhm.
these things come under self improvement and health. And so
Yeah.
let's get started on oral anatomy, basics of oral anatomy.
Okay. So before we begin with oral anatomy, there's one thing that I would like to add is that I've noticed that a lot of people consider oral health to be like secondary to the rest of the body. So by listening to this podcast, I hope that that changes. So yeah, now
Yeah.
let's dive into oral anatomy. Okay. So basically, let's start with the basics. So you have 32 sets of teeth, permanent teeth, right? And the upper jaw that you have is called the maxilla, and the lower one is called the mandible. And the teeth. So a lot of people usually get their third molars around 17 to 21 years of age, and some people and sometimes third molars don't erupt in the oral cavity. So that's one teeth that you might see that's missing from your oral cavity. And the other teeth that can be congenitally missing is canine. Um, so let's talk about the anatomy of a tooth. So every tooth anatomy varies, and it is a very deep topic. And I don't know if like I should get into that, but let's just um, do the basics. That a tooth has a crown portion and the root portion. So the root portion is basically what is embedded in your alveolar bone, and the crown portion is what you see. So the crown portion has three components, which is enamel, dentin, and pulp. The enamel is the outermost layer of your teeth, then comes the dentin and the pulp. And the pulp is where all your nerve fibers are. So if you have infection or exposure to infection and you see some amount of cavitation in your teeth, um, and if you feel pain because of any sort of stimulus, like when you eat hot or cold food, or when you bite onto something, that means your pulp has been exposed. And you might need a restorative or a root canal treatment, or if there's an extensive exposure involving resorption of roots, then you might need to get your teeth extracted.
Okay.
So these are the basics about the oral anatomy.
That was pretty basic. I understood every word you said. So,
Good. That
yeah,
was the goal. Yeah.
yeah. So, what deteriorates oral health over time? Factors,
So there are a
everything.
lot of factors that deteriorate oral health. It can be local factors or more generalized factors, like if you have any systemic disorders, like diabetes, that can affect your oral health as well. And local factors include plaque retention, and plaque can lead to formation of calculus, which is the calcified form of plaque, and it is difficult to remove, and you definitely have to get your teeth cleaned. And by cleaned, I mean a procedure called scaling. That's what you need to get done. And tobacco is also a factor that affects your oral health. Like if you smoke or chew tobacco, it deteriorates your oral health vastly. And since I've studied from India, I have seen a lot of cases like people with stained teeth. Like it was, they had very bad odor as well. And yeah, the oral hygiene was pretty poor. So yeah.
The only thing I can think of is how these people are uh, just having a romantic relationship. But, anyways,
Yeah, I think of
uh,
the same thing too.
yeah, like
Yeah.
all these people who come into any clinic and they smell really bad. Like, how are they carrying
Yeah. Like
out?
who would want to kiss them?
No, no,
Right?
definitely not me.
Yeah.
But yeah, so you mentioned tobacco.
Yeah.
How long would it take for someone to acquire that bad, like deterioration of oral health? Like
So
any
it depends.
factors?
Okay, so it depends on the frequency, like how many times a day you consume tobacco.
Yeah.
So I have seen certain patients who come in who chew tobacco like 10 times a day, like 10 packets a day. So like it takes like um a few weeks to months for their oral health to start deteriorating. And there are some people who smoke a lot. So in India, we have like the cheaper version of tobacco for smoking as well. So people report with a condition called smoker's palate, wherein you feel burning sensation on your palate and stuff like that. So yeah, it's pretty bad.
This is the most common walk-in,
Yeah,
like
it is. It
tobacco.
is. Yeah, it is. So like we had an OPD of 300 patients every day, and out of that, like 200 would be tobacco stained teeth. So
Well,
it was a lot. Yeah, like
it gets easier once you get 200 every day. You're doing the same
yeah.
thing,
Yeah, like it
treating the
doesn't
same.
matter. Like
Yeah.
yeah.
Yeah. So what else? You said diabetes. Like,
Yes.
what kind of metabolic, if you can go into a little bit of what kind of metabolic disorders or even any health problems that are associated to
Okay.
oral health
So,
dysregulation.
diabetes is one of them. It makes you more susceptible to infections because the sugar content in your blood is higher.
Right.
Um, the second thing is if you have HIV or any other immunosuppressive disorders that like brings down your immune responses, and
Mhm.
that makes you more susceptible to oral diseases as well. The other one is hypertension. So if your hypertension is like if you have some amount of medication, it can make your gums swell. A certain medication can. Um, so if that happens, you just need to ask your physician to swap your medication with something else. And it is important to have your hypertension under control because if you are performing any surgical or extensive oral procedures, um, it is important that your blood pressure is under control, right? So yeah,
So yeah, so all these, what I'm understanding is what all these problems, diseases, whether it's diabetes, hypertension,
yeah,
they are all kind of associated to bad or oral health. There's a
yeah,
some sort of association.
yeah.
So that's a
But
good
even if
feedback.
you have such conditions, it is important that you take care of your oral hygiene.
Yeah.
So yeah, like brushing twice a day is so important. Like brushing at night is more important than brushing in the day. So yeah.
Why is it? Why would I be fine with
Um,
brushing at night only?
Actually, your oral hygiene would be better if you brushed only at night, but it is still important to brush during the day as well. But if you do it at night, so basically the amount of bacteria that stick to your teeth at night and they produce a lot of acids, which can cause like decalcification of your enamel or increase your risk to infection exposure. So it is more important to brush at night because you get that environment in the oral cavity for the bacteria to thrive at night. So it's important to brush.
So would you say that if I only brush at night, not in the morning, is
Hmm.
that the most would would that be fine? Or to optimally take care of your oral health, you have to brush in the morning too?
To optimally take care of your oral health, you have to brush in the morning too, but you cannot keep brushing at night.
Okay, so brushing at night is necessary at all costs.
Yes,
You have to do
it
it.
is very necessary. Yes.
Okay.
Yeah.
So I have to actually make that habit because
Yeah.
I'll some days, I confess, some days I won't brush at night. I'll just use a mouthwash.
Okay, let me tell you, I am a
Okay.
dentist and my parents won't listen to me. They don't brush at night. They
Okay.
don't. Yeah. I tell them like multiple times to do that, but they don't.
Yeah, well, you get lazy at night. That's
Yeah,
why.
but
But
they
I see
brushed like 5 days and then they stopped.
weekends for brushing teeth.
Yeah. No, that's not good.
Yeah. So how about mouthwashes? What's
Yeah,
the deal with
so
them?
mouthwashes come secondary to brushing. And if you have like a bad odor or anything like that, it is important to use a mouthwash. You can use Listerine. Listerine is a good mouthwash. And if you're susceptible to infections, then we usually recommend a mouthwash that has chlorhexidine in it. So because
Chlorhexidine?
yeah,
Okay.
yeah, because of its antibacterial properties, it is a good mouthwash as well. But if odor is your only issue, then Listerine is a good mouthwash to use. And I also recommend like flossing. Um, a lot of people don't do that,
No.
and it does not clear out your interproximal spaces. So interproximal spaces are basically the space between two of your teeth. So a floss basically goes between that and cleans any debris or anything from that area. So it's important to floss as well.
Haven't flossed in years.
Have you ever flossed?
Yes, I have. I also have a floss bag with like maybe 50 flosses. But
Yeah,
I
you
bought
should
it as
use
a way.
that.
I just bought it as a way so that I could hopefully create a habit of flossing, but it just never sticks. So if someone never flosses and just brushes once a day, what
Yeah.
are the consequences of that?
Okay, so there could be plaque accumulation, and plaque can cause gingivitis, which is basically
Mm.
swelling of the gums and which can lead to bleeding of your gums. So that is the consequence. Yeah.
Okay, gum bleeding is one of the things that I have had in the past. So, and
Yeah.
it just
So,
creeps up once in a while here and there, which is really concerning sometimes. But I have to I have to go to a dentist soon because of all the issues that I don't
mhm.
want to.
Ideally, a person should get his or her teeth cleaned as well, like every 6 months.
Mhm.
Yeah, so that is also important to avoid any plaque accumulation or for the plaque to convert into calculus.
Yeah,
Yeah,
6 months,
yeah,
definitely. It's like, see, this stuff does not come into overall health lifestyle. No one talks about this.
mm, yeah,
Oral health is like, we'll just use the mouthwash and like bare minimum, bare basics. Even I have done
yeah,
that before, but like from this year, I have been trying to like set everything right, like be a holistic kind of person, health wise,
yeah.
because I have had issues with oral health.
hmm And one more thing that I've noticed is that people have a lot of misconceptions about flossing. At least in India, I have noticed that, like they feel that their gums are gonna go down, or like their their teeth are gonna wear off if they floss, but that is not the case. Like
Mhm.
flossing just helps you maintain your oral hygiene.
Yeah.
Yeah.
So, question about the gums. What causes the gums to reduce or lower?
So there are a lot of factors that like cause it to reduce. It can be due to age as well. It can be genetic, or it can be due to any of the periodontal conditions. So basically, periodontal fibers are the ones that hold your teeth to the bone. So they support your teeth basically. So deterioration in the periodontal health can lead to um, lowering of your gums. Yeah.
Could brushing like rigorously also reduce it?
Yes, it does. Actually, brushing vigorously causes um, a wear of enamel from that area, and it can cause more sensitivity as well. So if you like eat ice cream or have iced water or anything like that, you might feel sensitivity on your teeth. That is a more common thing what brushing vigorously does.
Yeah. So, if I was gonna say like, could you reverse any of these effects? Like you said, NML wearing off,
Yeah.
the gums being shaved off. Could you like reverse it in any way? Is it like a is young people are better than like so? Give some sort of like explanation to that.
Okay. So for sensitivity, there's a gel that that you guys can use, and that can help you control that. But if the wear is more that it has caused the cavitation in your enamel, then we can definitely restore it using a dental cement, and which would be similar to your tooth, so that it wouldn't matter, and then you wouldn't face the same issue again. You like about the periodontitis. So periodontitis can usually be controlled by if there is a lot of infection, then we need to give antibiotics. That's at least what we do in India. Um, and if the I mean, your gums have recessed quite a lot, then we need to perform a periodontal surgery to bring the gums up.
Okay.
Yeah.
So for the enamel,
Yeah.
you kind of can reverse that problem if it reduces
Yes,
with the
kind of,
gel,
yeah.
but
Uh-huh.
with the periodontitis, the only way is surgery.
Yeah.
Okay.
If it is like too extensive, the only way is surgery.
Hmm.
Yeah.
Okay.
So sometimes you do like the loss of periodontal health. People experience a loss of teeth as well,
Hmm.
and it is very common. Like the teeth becomes mobile, and you wouldn't have any other option but to extract it and put some prosthesis instead. Just for patient comfort.
Yeah.
Yeah.
So what about teeth crowding?
That is actually very common. Um, so your child's first dental appointment should be by the time your child is 1 year of age. So that's how early you should start going to the dentist. Um, So especially during like the mixed dentition period, like when you have your primary teeth, but your permanent teeth are also erupting, and if the space is very little for your canines to erupt, the canines tend to erupt more buccally. The upper canines tend to erupt more buccally towards the outside, towards your lips, which results into the stage we call the ugly duckling stage. So basically, crowding results because of less amount of space for the tooth to erupt. It can be due to a lot of reasons. It can be genetic because of your shorter arch length or arch size, or it can be due to late exfoliation of a primary tooth or early exfoliation of a primary tooth. Yeah, so there are a lot of factors for crowding.
Do you think if there's a difference between kids who are on high processed diet, like high processed diet, they eat chips, they eat
Hmm.
candy, sugar, high sugar foods, soft foods, eh, compared to kids who actually eat like harder foods like fruits, maybe chicken, rice.
Yes, obviously it makes a difference because if you're having more sugary drinks or more acidic drinks or a carbohydrate or fat-rich diet, it's gonna affect your oral health because like when you have cold drinks, for example, that has a very high sugar content as well as it's very acidic. So that causes deterioration of your oral health. Definitely does affect your oral health. So it's very important to have healthy food like
Cooked
green
food.
vegetables,
Yes.
yeah, and vitamin-rich food because it's a growing age for children, and this is a time when they should get the most amount of nutrients, for the developing body.
So do you think the food kind of determines the strength of the teeth of the kids? Like if you're eating more healthy food, like more like let's say protein based, carb based, like fruits, veggies.
I wouldn't say strength, but it does help them maintain the oral hygiene. So a lot of kids they eat a lot of sugary foods and stuff like that, and which causes their oral health to deteriorate early, which would lead to early wearing off of your primary tooth. So it's important that you incorporate healthy things in your um, healthy items on your in your diet. So
Mhm.
yeah.
Yeah, because when I was a kid, like no one, we would eat like these Indian snacks and this and that. It wasn't
Yeah.
until I came to US, I had to go to orthodontists to get my braces, and I still, my teeth are still aren't straight here in the front, but they're straight enough.
Hmm.
I always wondered like what kind of caused that tooth, like tooth crowding and this messiness that occurred in the mouth.
Yeah. So another thing that I would like to mention that even I went I went through an orthodontic treatment, but I did not wear my retainers, and that caused all of my teeth, I mean, the entire thing to relapse. So I think why wearing retainers is important is because it takes some time for your soft tissue to develop around the new position and your PDL fibers to um, attach your tooth at that location. So
Mhm.
that's why wearing retainers is very important. And yeah, I learned it the hard way.
After I was in that phase where I had to wear retainers, I think I remember like after a week of wearing them, I just stopped wearing them. It was
Yeah.
just so tough.
So you usually have to need to wear it for like 6 months or over if required. It is important to do that.
Yeah,
Yeah.
it's like being
Yeah.
kids.
So patient compliance is really important when you have to wear retainers, especially if they're removable retainers. You usually just remove it and you don't wear it again. Yeah.
Yeah, awesome. All right. So what are some protocols that we could all, if you can give us like a list of things that we should do and
Mm.
should do first so that we don't get all these problems or like manage the problems we have.
So let's start with your dental appointment.
Yeah.
So every person should at least visit dentist once every 6 months. That is, I'm saying ideally, but if you have any conditions, then I would recommend every 3 months. And your first dental visit should be at 1 year of age. And yeah, the other thing that I want everyone to follow is brushing twice a day, using mouth rinse and flossing as well. So these are some of the things that you need to take care of. Even as adults, we should limit our sugar consumption because that's going to affect your oral health, or cold drink consumption, or anything that affects your oral hygiene in a bad way. Yeah, so that's what I would like to say.
Yeah. That's pretty well. People know most of the stuff. Like flossing. Flossing is a very good example.
Um,
Flossing
yeah,
is a
it
very
is.
good. No one flosses, or at least around me, I have seen no one flossing. So,
Yeah,
but people will
and
brush their teeth.
especially,
Sorry.
yeah, and especially you should brush at night when you've eaten some sugary thing like a dessert or something after your meal. It is very important to brush, yeah,
Yeah,
at night. Yeah.
definitely. So, what do you drink? Drink soda?
No, I don't. I've never drank soda in my life.
Just because of all these problems that it could create.
No, I just don't like the taste generally.
Yeah,
But yeah, this is an addition that it maintains my oral hygiene as well. So,
yeah. What about alcohol and what about
um,
yeah, alcohol, coffee, any drinks that you don't have?
so alcohol and coffee, I don't consume them too often,
Yeah,
but like coffee can stain your teeth externally, but once you get your teeth clean, those stains come off. But um, yeah, I would recommend drinking as much less caffeine as possible because it does um make your teeth look brownish in color because of the stains. Yeah.
I do drink coffee every day, so maybe you
Yeah,
can
but
check
you
my
should
teeth.
just maybe you should just gargle after you've had coffee or
Yeah.
something. So it does not leave any residues on your teeth or face.
Hmm. So how about alcohol? Is alcohol any good for oral? Well, alcohol is actually no good for anything, but
Yeah, for anything it is not good.
yeah. But so alcohol
So
obviously will.
occasional alcohol is fine,
Oh
but if
yeah,
you are a chronic alcoholic, it's definitely gonna affect your oral hygiene in a lot
yeah.
of ways. Yeah, oral health.
I always wonder how those people who come into the clinics and have romantic relationships, being alcoholics, avid tobacco users,
Yeah.
brushing like half, like brushing like once a week. week. But it's some of those people, you just leave them alone.
Yeah. So some of the people I've seen who come in at my clinic at the hospital I used to work at in India, so they wouldn't even brush their teeth. So in India, some people, not all of them, like a few of them, still use a thing like that. There's something called as datun. They use that
Yes.
and they chew on it. So they think that that would make their teeth clean, which does not do that.
Oh,
Yeah, so
thank you.
you do need to
This
brush.
this is the first time in the podcast, in my series of podcasts, where we have tackled something Indian and kind of broke it down and told people that this thing is bad because it
Yeah.
originated in India, because there's a lot of things in our culture that are like that.
Mm-hmm.
And number one, this is the first example on here where
Yeah.
they use,
Yeah. Yeah.
yeah,
And there are still people who believe that that one is going to help their oral health.
yeah,
Yeah.
but it doesn't. Why doesn't it? I want to use
Yeah,
it every
because
day too.
no. Be- because if you chew on it, then it's
Yeah,
just gonna wear your teeth off and it does not actually remove the plaque and everything that's stuck on your teeth. It does not. So yeah, brushing is important.
yeah. So this is my curiosity question. When we
Yeah.
were back in the day living in the forests, like how did we take care of our oral health? Was that even a thing? Did we even give a shit about it? Like what do you think? What do you think is a possibility?
I think that one would have been one of the possibilities during the forest age, but
Maybe that was the
yeah,
best thing they
no
could get a hands on.
brushing. Yeah, you could chew on that. That was the only thing.
Yeah.
And in Indian culture, like people were obsessed with pan,
Yeah.
which had tobacco. Yeah, so people thought that would make their breath smell really good. So instead of mouthwashes,
That's
they
such a
gave
myth.
pan. Yeah.
It's take I can feel after eating pan, my breath smells horrible.
Yeah, I
Like
hate it. I hate it so much.
the way I check my breath is licking my top of my hand, and then I smell it.
Oh, okay.
And when I eat pan and when I do that, it's the worst smell I could ever smell. But
Yeah.
it's myth
Yeah,
number
but in the
two.
olden times, like people thought that,
Yeah.
yeah, it was like a freshener, mouth freshener.
Yeah.
Yeah.
Yeah. So what are the other things that you want to touch on about oral health?
Um, I think I pretty much covered the basics.
Basics.
So,
How about
okay.
you tell us the difference between American dentistry and Indian dentistry, if you have any idea?
Um, the major difference that I've seen in American dentistry is the kind of medications they prescribe.
Okay.
So in India, we usually are high on antibiotics. So everybody loves to give antibiotics, and we usually give painkillers, but they're definitely not opioids. And in US, I've noticed there's an increased amount of opioids in the drug prescription, which is the difference that I've seen. And I recently did a course, online course from Harvard University, which was opioid crisis in America, and they even
Big.
told yeah, they said in the video that the dentists and physicians and even the pharmacists are trying to regulate the amount of opioid circulating through the community. Like they're taking certain measures to um, control the crisis as much as they can. But um, since I don't live here, I don't know how effective that is. So
Yeah. Well, the big pharma here is huge, massive. I was
yeah,
talking with I was talking with Dorian Sones, which is a podcast that I had with who is the person who I had a podcast with. It was around two, and where we talked about how powerful drug companies are in today's day and age, where
yeah,
the medical model of treating diseases was based on microbial agents, because
Hmm.
like antibiotics, you can prescribe it to someone, you can treat them immediately,
Yeah.
but now it shifted where they're using drugs to treat diabetes, hypertension, and all that
Hmm.
other metabolic disorders, where those in fact could be effortlessly treated in 3 months of prescribing them a resistance training program, or like ex, some sort of exercise. It's not, it shouldn't even have to be weight training. Some sort of exercise, they'll improve their diabetes, they'll improve their hypertension, and if they improve that those two, they'll definitely improve their oral health. So
Yeah.
that's how I see it.
Yeah.
We are upset, like healthcare here is obsessed with drugs, pharma. Being a pharmacy tech, it's kind of against what I believe in, but since I
Yeah.
need the experience, so I'm working as a pharmacy tech right now. But I
Hmm.
have so people here are given like a pile of meds every day, like this huge pile of meds. It's crazy to me that we are feeding all these
Crazy.
people,
Yeah.
sometimes
So
unnecessary
many
drugs.
medications you're feeding these people. It's crazy.
Yeah. There's also a podcast I listened to recently where it was a Joe Rogan podcast. I don't know if you know who Joe Rogan is, but he's a good, big podcaster. He had a UK doctor on the episode where they talked about how um, most of the drugs are ineffective, like they're
Hmm.
straight ineffective.
Hmm.
Antibiotics and antimicrobial drugs might be like really effective, but other drugs that
But
just
like if you take antibiotics too much, you can develop resistance to it, and the next time you would need a higher dose of the antibiotic to like work for your body. So that is also a concerning issue.
yeah.
Yeah.
Yeah, but I'm really glad. Like, what else did you learn in that course? Like opioid crisis in America. Like, if you want to share something.
Yeah, so there were videos wherein they showed people who were addicted to drugs
Yeah.
and how they got out of it, their journey to and um I also saw that they regulate the drugs by asking for the patients for like the prescription every time they refill their prescription bottle. And yeah, they pretty much then like the pharmacist, they pretty much contact the physician directly if they feel like a patient is taking more than required amount of opioids.
Hmm.
So that's
Yeah.
what I, yeah.
Pretty cool. Pretty
Mm-hmm.
intense stuff that's going on.
Yeah, it is.
I don't know
Yeah.
how it's in India, like the health medical system. But I am in the process of having a podcast. But I have to reach out to him really well. It's so hard
Mm-hmm.
because he has a
Yeah.
little bit of bigger, very big following, but he's a psychiatrist in Ahmedabad, and
Oh, okay. What's his name?
his last name is Dave. I think I follow him on Instagram. I really want to have him on the podcast. He's a psychiatrist, so
Wait, I might. Yeah, okay.
yeah, but his stuff is his stuff is in Hindi, but everything that he says is all backed by science, medical research. Um,
Yeah.
sounds good to me. So I'm gonna try reaching out to him. I love the difference between like difference of cultures and difference of medical systems between two different countries and
Yeah. Yeah.
misconceptions, myths.
Mm-hmm.
So
Mm.
that's one of my goals for future whenever it happens, not in a rush. But yeah,
Yeah.
what are you doing right now? Tell everyone like what's if so you are a
So,
doctor of dentistry in India, or you have a bachelor's of
yeah.
dental surgery, but what is the process to
Yeah.
become a dentist in United States if you have background?
So, you need to give INBDE exams, which is like the National Dental Board exams in United States. Um, so if you pass that exam, You need to do DDS for 2 years more, and then you would be a dentist in the United States. So INBDE is a 12-hour long exam. First day 8 hours, second day 4 hours, and combined 12 hours. And you need 75% or higher grade to pass that exam, basically. And there are a lot of like a lot of INBD content available on YouTube as well. And there's this website called Dental Bootcamp that I use for my INBD prep. And yeah, that's all.
Yeah, so 2 years, and you
2 years.
hopefully, after passing the exam, you can be a
Hmm.
doctor. So what is that exam
Yeah.
like? Just, I don't know, highly compressed dental school knowledge in.
Yes, you can say that because you get a mixture of MCQs, like you get cases, you get X-rays, you get factual information on on the test. So yeah, it's pretty much everything that you've studied throughout the dental school. It's
Yeah,
everything.
12 hours is, well, that's huge. What
Yeah, it is
do you have
it
a
is
date
quite a
when you're
lot.
taking it?
Yeah, probably. I haven't taken a date yet, but I'm planning to take it in September end or October. Yeah, because I'm still waiting for my EC evaluations to come in. So once that come in, I can take a date.
Okay, that's awesome.
Yeah.
All right, what are your business plans? That
Okay.
that's probably, I would say that's probably your path one. Path two is maybe doctor of dentistry in the United States, but path one is
Yes,
business.
pretty much. Yeah.
Yes.
Yeah. So in India, two of my colleagues and I have come up with a business, and it is called AmbuDent. And as the name says, it is ambulatory. That means it's a mobile dental clinic.
Hmm.
So we pretty much go to the people's houses, set up our portable dental chair, compressor, and everything, and we would perform the dental treatments. And we have also invested in a portable x-ray, so it would be nothing unethical. We would always take your x-ray first and give you a treatment plan accordingly. And we want to start off with villages around Ahmedabad. Uh, so the people who don't usually get dental care that easily, we want to reach out to them first and then move to the city area. So the main goal behind starting this company was that we could reach out to um, old people, because since they cannot move that much, or some of the people who are bedridden, they could get dental treatments at home. So our main goal is to reach out to them first. So yeah, that is the brand.
That's a very awesome business idea. Who inspired you guys to come up with this?
So we had this subject called public health dentistry, and there was a chapter where they had this concept of mobile dental clinic. And so one day my colleagues and I were just sitting around, and we just came up with this idea that why don't we start that for like to serve the community in a better way. So
Awesome.
so people usually procrastinate going to the dentist because some people are scared of the environment, or there are issues like appointments, late appointments,
Yeah.
or appointments that might not be suitable for their timing, or if their pain is very acute. And for those reasons, we started this company so that we could reach out to people whenever and wherever they needed us.
Yeah. I think this is a great idea
Yeah.
because you you cannot do this online. Like you cannot do
Yeah.
this through a Zoom meeting. You cannot, it's not like a therapy session where you can schedule a Zoom meeting and you're doing therapy session, or
Yeah,
it's
it
not
is
like
not.
a diagnosis session where you can like ask the other person question and they'll respond. It's like you really have to look at their teeth and everything that comes
Yeah,
along with that. So I think it's
yeah,
the best thing you can do in today's day and age. with
Mm-hmm.
dentistry. So I hope that works out. Yeah,
Yeah, I hope so too. Fingers crossed.
fingers crossed.
Yeah.
Yeah. It's always good to see two paths in life in terms of careers. Because
Mm-hmm.
if you're stuck with one, I'm not gonna say it's like it was meant to be, but if you have two paths in life, it's just better for you to pick and choose because options are always
Yeah.
necessary. Because what if you
Yeah.
jump back out of, let's say, path two to pursue path one?
Mm-hmm. That's correct.
So there's a difference between spreading yourself too wide and spreading yourself in two
Mm.
different directions. If you spread yourself in two different directions equally, that's much better than spreading yourself into five different directions.
Yeah, that's true. Yeah.
Two is always a balance, because that's why I do
Mm-hmm.
like YouTubing. It's sort of similar like business. You
Mm-hmm.
don't have employees, but
Yeah.
it's the
And you
organization is the
do
same.
get to learn a lot.
Yeah,
Yeah.
especially when you were talking about the social media of Ambudent, the company.
Mm-hmm.
If
Mm-hmm.
you also had previous social media background, so like you can learn a lot with just having like a
Yeah.
social media account, marketing stuff, and everything.
Yeah.
So
Yeah.
yeah, so yeah,
You learn a
this
lot of different things. Yeah.
definitely. All right, so what?
Yeah. I think everything has its pros and cons, and you just need to weigh out like which one has more pros.
Yeah.
Hmm.
So any last advice for people? Comments, concerns, inspirational quotes, messages?
Um, I have already mentioned as I wanted to say, but yeah, it is. So one thing that I would like to add is like taking care of your oral hygiene is just as important as taking care of your body because um, a lot of people feel that oral hygiene is not as important, but yeah, it is important too.
Yeah. So
Yeah.
basically, for the boys who are listening, your biceps are important, but your teeth and oral hygiene are more important.
Yeah, exactly. How
Yes.
would you communicate with anybody
Anybody.
like with a bad breath?
Yeah, with a bad breath and bad teeth. So
Yeah. So yeah, biceps are not the only important thing.
yeah, definitely.
Hmm.
Well, that conversation will be an hour-long conversation. So thank you for coming to this episode
I thank you
about
for
oral
asking
health.
me.
Yeah, definitely. Anyone who doesn't know, Nishi is my cousin, so that's why it was super easy to get her on an episode. And it was a good conversation. We already probably crossed like 45 minutes, maybe, and we hit everything that we had to talk about.
Okay.
Okay.
Okay, that's good.
All
Yeah.
right. Thank you, everybody. See you in the next
Thank you for
episode.
having me.
You're welcome. Bye.
Bye.